Mentors. I'm Dr. Sheena Bhuva.
And I'm Dr. Benecia Williams.
And together we are Benecia. Okay, so today we have Dr. Stephanie Tao. She's a pediatric rehab specialist who actually just graduated from her second fellowship, which was in pediatric sports medicine. So congratulations on that. That is amazing. Stephanie has done a lot of stuff in our rehab field. She's been super active in a bunch of different organizations. So today we'll have plenty of stuff to talk about.
Yes, so Sheena and I got the pleasure of meeting Stephanie when we were PGY2s, probably at a conference then. And then both Sheena and I went and rotated at UT Southwestern. Baylor residents go over there to do burn rehab for a month or two. So we got to work with each other then, which was amazing, and just have been friends and in contact since then. So Stephanie, tell us a little bit about yourself, where you're from, your training.
Yeah, thanks for having me, guys. I'm really excited to be here and really honored. So you guys have done such a great job with building this up already. And I wish that this was available when I was a med student. So I'm from New Jersey originally, which I think people always tell me they have a hard time telling. One, because I don't have the accent, and two, my CV has been all over the place.
I didn't know that.
Yep. So from New Jersey originally, grew up there all the way through high school. Then went to Johns Hopkins University to do a BA in neuroscience. Did a gap year doing a Fulbright in Hong Kong after that, and then went back to New Jersey for medical school at UMD&J, which is now Rutgers, New Jersey Medical School, which is affiliated with the Kessler Rehab program. And then I did my intern year in internal medicine at University of Maryland Mercy Medical Center, then I moved all the way to Dallas to do my PM&R residency at UT Southwestern, which is where I also did my chief residency. And then I moved to Denver, Colorado to do my pediatric rehab fellowship for 2 years. And then now I'm in Kansas City, finishing up my last fellowship in pediatric sports medicine.
PGY7 for holding it down.
That's great. Yep. And, like we had talked about last week with Dr. Taylor Kristen, so pediatric rehab, the fellowship is 2 years. So really, Dr. Tao's done 3 years of fellowship. So tell us a little bit about why you went into pediatric rehab, and then why did you decide to specialize even more into sports medicine? And was that something that you had known that you were going to do when you had started residency?
Yeah, so I was lucky having gone to medical school where there was a very large PM&R residency and department presence. I was fortunate to get exposed ever since first year of med school, because we had PM&R physicians lecturing us on musculoskeletal issues. I remember Patrick Foy, he was like one of the big ones that did lectures. And then we had a pretty big presence for our PM&R interest group. And so I don't know if everyone knows this, but UMD&J, which now Rutgers, used to be, or I think they still are, the biggest allopathic medical school that churns out PM&R trainees. And so in my class, we had 13 people who applied to PM&R, which is like pretty much unheard of in all the other allopathic medical schools. And so my first year of medical school, unfortunately, I tore my ACL. I had gone into medical school thinking I was going to be a surgeon because I love being hands-on. And when I tore my ACL, I started looking into sports medicine because I tore it skiing moguls. And so it was a sports-related injury. I met my orthopedic surgeon at Hospital for Special Surgery. I got involved with the Hospital for Special Surgery summer internship program for medical students who were interested in sports medicine and orthopedics, and did some research there. And then I was like, well, since I'm at Rutgers, I know PM&R is a big thing here. I should probably check it out and figure out what's the difference between orthopedics and PM&R. And I realized I actually was much better fit for PM&R, because whenever I was with my orthopedic surgeons, I did not like that I only had 10 minutes to talk with my patients. And, a lot of them were, at that time, we were seeing like post hip replacements or knee replacements, and they'd be like, is it squeaking? Do you have any fevers? Like, everything good? Okay. And then I would be like, Stephanie, do you have any other questions? And I'd be like, yeah, so how are you doing with your stairs, like your therapies? And that's what I realized, like, I loved focusing on that functional aspect. And while I liked being in the OR and doing procedures, I realized PM&R still has that good balance of you get to do procedures, you get to do, follow your patients a lot longer and just develop that relationship with them. And you still get to work closely with orthopedics. And so that's kind of when I realized I was better fit for PM&R. I am the oldest of 4 kids, and I've always loved working with kids. My Fulbright was actually in education as well. And so I got to work with kids all the way from like kindergarten through college aged. And so I've also always loved teaching. But with the kids aspect, on my pediatrics rotation, my 3rd year, I was like, well, wait, I forgot that I actually love working with kids, and maybe I should look into pediatric rehab. And so I rotated with some of the pediatric rehab doctors in New Jersey, loved it, loved working with children with disabilities. They just brighten your day. And it's just a different energy. And so that's when I was like, okay, I know I'm pretty sure I want to do pediatric rehab. So then I made sure to interview at residency programs that had a strong PM&R, peds rehab presence. And the way I gauged that was whether or not they had a fellowship, because I think at that time there were only less than 20 programs that had fellowships. And so, there were a couple interviews I went on that didn't have any, but for the most part, all of them did. And then, kind of when I started residency in Dallas, that's when I was like, well, I still have this passion for sports medicine too. And that's when I met Shane Miller. So UT Southwestern used to do these sports medicine workshops once a month in the evenings, and I would go to these, and I met Shane Miller, who's a pediatric sports medicine physician at Scottish Rite, and he's pediatrics residency trained. And I was like, whoa, I didn't realize this existed, because my only exposure up until that point had been working with family medicine or PM&R doctors who do sports medicine. And so it opened up this whole new other world for me, and I was like, well, maybe there's a way I could do both. And I always have had a passion for doing adaptive sports too, and wanting to develop the field of sports medicine for youth athletes with disabilities, which I think is significantly underserved right now. And so I went into my pediatric rehab fellowship, still thinking I'll probably see what it's like if I still want to do pediatric sports medicine, because it's in another year. I think luckily at Colorado had great experiences and exposure with their pediatric sports medicine doctors there, that I realized, yes, I want to do this. And so pursued applying for pediatric sports fellowships.
Nice.
That is awesome. I know Sheena and I have been fortunate enough to cover some adaptive sports things with you. And anything, when you come back to Dallas, if you need help, please let us know. We are in town, so we would love to get involved. I volunteered Sheena, but I know she wouldn't mind. Speaking of adaptive sports, you've done a lot of things with the skiers, with swimmers. Tell us some of the things you've gotten to do with adaptive sports and how you got involved working with the US Paralympic team.
Yeah, so I will say, adaptive sports is one of those things that I think a lot of people talk about in the PM&R field, but it's still a very small field, and there aren't that many people who specialize in it. And so I'll say I've seen the most popular ways I've seen people kind of get involved is by going into pediatric rehab or doing a spinal cord injury fellowship. But there's certainly other ways that you could do it. If you want to specialize in amputees or individuals with limb difference or deficiency, that's another big route, because a lot of them are involved in adaptive sports. For me, when I went to Dallas, I remember in my interview asking about it, and no one really knew. And so I'll tell you this, yes, there are a few programs out there that will brag that they have great adaptive sports exposure. And hopefully with me coming to Dallas, since I left, we developed the Adaptive Sports Coalition. I would say that we are one of the stronger programs with exposure to adaptive sports now. But back when I was interviewing, all the faculty I talked to didn't really know what I was talking about. I know the big programs I knew of were RIC, which is now Ability Lab at Northwestern, UPMC, probably UW. But even at Kessler, I don't feel like we talked about it, but I don't think we really covered a lot of it. I did at the youth level in medical school. Jen-Fu Cheng, who's a pediatric rehab doc there, created an adaptive climbing program there. And so I got exposure more as a volunteer, but not necessarily on the medical sideline aspect. And so when I went to Dallas, I knew there were a lot of different organizations. And so I started talking with therapists, recreational therapists, a lot about the different recreational programs out there. And I connected with a recreational therapist at Scottish Rite, Dana Dempsey, who told me all about these different adaptive sports organizations in DFW, a lot of the camps. And so I started volunteering at a lot of these different things and getting more exposure, learning about the different sports out there and how you adapt things. And I worked with you guys at the wheelchair motocross World Series or World Championships. And so that was a big event for us. But before that, no one really had any relationships with the adaptive sports organizations at UT Southwestern. And I know you guys even had done a better job at Baylor, making those connections. And so I think different politics. Yeah. I know Kathy Bell came in and she was really supportive, and she's like, we need to, get with Baylor and help support these organizations. And like UT Southwestern's marketing department, like, I don't know what it was, but like back then they were very hesitant about it and they didn't really understand the need. But I think now they get it because it's blown up. And so I got some exposure. When I interviewed for pediatric rehab fellowships, I met Pam Wilson, who was my fellowship director in Colorado. And even before I matched, so Pam is like awful with emails. And even if she's listening to this, I doubt she is, but she knows it. So I'm not like throwing her under the bus. But she emailed me after the rank list was due. Like I always send my thank you emails, and she emailed me after the rank lists were due, like the week after, being like, oh, here's some information on getting involved with adaptive sports. And by the way, US Paralympic Swimming is doing a course this year, like next month, for national classifiers, national medical classifiers. And my first thought was like, Pam, you know that the rank list was due already, right? Like I already submitted my rank list. Luckily I ranked them really highly, and so like I knew I really liked them. But she was really helpful. So Pam is in a wheelchair, and she has done a lot of different adaptive sports personally in her life, and so she is well connected with US Paralympics, and her sport of choice nowadays is curling, and so she's currently on the world curling team. Just missed, she was, I think my first year of fellowship, had trialed for the US Paralympics team and got I think she got number 6, and they only took 5. And so she just missed it for being a Paralympian, but she was really well connected and also serves as a classifier for track and field. And I think she did swimming back in the day. And so I still think that she was a huge contributor to connecting me with US Paralympic Swimming. And I to this day thank her for all those opportunities, because I know I've met other people who have tried to get involved, and I think these organizations, because they're such an underserved area, they're often short-staffed, and so they get overwhelmed with emails. They're not always quick to respond, and it's really hard to stand out when a lot of people are emailing to ask to volunteer. And so I think luckily with my credentials, being a PM&R physician and a past swimmer, and then my connection with Pam Wilson, they took me into the course. And so I was one of, I think, 2 physicians or 3 physicians who actually trained at that course. It's a very small group. And they have not done any, I was lucky because the timing of it, they haven't done any of these classifier courses since then. And I've been talking with US Paralympic Swimming about why. And it's, I think, because a lot of things are changing with the world para swimming environment and the International Paralympic Committee. They're holding off until some of the adjustments are made, because classification, the process has been evolving. And so through my relationship with them, over the years classifying with them, I've kind of shown them my medical knowledge. And because with classification, you need to talk to the athletes about what their medical diagnoses are. And to be a medical classifier for swimming, you have to, for the physical exams, you have to be either a physician or a physical therapist. And that's just for like the physical impairments. So if you have visual impairments, then you're like an optometrist or ophthalmologist. And then the cognitive ones, I think there's, you can be like psych or neuropsych or what have you. But for me, I got to show them that medical knowledge, because we really understand these diagnoses that cause these impairments. And then we also know what the functional manifestations were. And so I was set up for success there with my PM&R training. And then unfortunately, because the Paralympic world, a lot of the sports are very undercovered in terms of having a physician present. Unfortunately, at some of the events I classified, there were medical emergencies. One, which I was in California, where we actually emergently took this adult athlete to the ED, and she had flown in by herself from Arizona, went into like paroxysmal dystonic crisis, like stopped being able to breathe. She had this complex medical history, and I was like, I'm the only one that knows. And so even the ENTs were like, it was just so frustrating, guys, because they were like male ENTs who were super condescending, being like, who's this woman, right? And she's like, miss. And I'm like, it's doctor.
Yeah, nice.
And I know what I'm talking about. And so they were like, I was like, I need to ride in the ambulance with her. And they're like, well, let me ask her permission from the driver. And I was like, okay, you don't understand. She doesn't have family. And finally, they let me into the ambulance with them. And, I get friendly with them. And they're like, what's an anoxic brain injury, doc? And I was like, oh my God, like, like, thank God I like went with you guys. But you know, she went to a community emergency department, and I know how these things work, where they're like, oh, you're at baseline, you can discharge her to the street. And I'm like, I don't want that to happen to her. And so I think Paralympic swimming saw how resourceful that was. At the same time, for years, they've been advocating for having a physician. And because of this emergency, it kind of expedited things for me to serve as their team physician now. And so I
chills when you told me that story. I was like, that is
Yeah.
great. So glad you were there.
Yeah, it's crazy coincidence. And like, you know, usually most of the events I've classified, there's usually no big emergencies. Yeah, sometimes someone with visual impairment may like bump their head or, you know, jam their finger in a lane line, but nothing huge like that. And, you know, we started getting into her medical history, and I was like, you know, we're seeing a lot more complicated disabilities get involved with parasports and adaptive sports, because people are getting to know, you know, the Paralympic movement is out there and people are hearing about it more. They want to get more active. We're pushing people to get more active because it's the right, you know, it's the healthy thing to do. And so we need to be prepared to better support them. And so that's my passion with supporting these athletes. In Colorado, our Children's Hospital Colorado also had started years ago an adaptive ski program, and it has now evolved. So it started with Children's Colorado as like the handicap ski program or something, and now it's developed into the National Sports Center for the Disabled. And now that NSCD oversees the smaller program in Children's Colorado. And so a lot of our orthopedic surgeons and our PM&R department and our peds rehab department, some of them are involved in that too. And so actually, I think I was like the first fellow to get involved, but Pam and her husband have been involved with the program. And so that's kind of how I got involved.
Very cool.
Yeah.
So, you know, some of our viewers here, they may not know exactly what it means to when you're classifying patients. So Benecia and I, we actually did some of the classifications for the athletes at the VA wheelchair games about 5 years ago. But for swimming, so just, you know, briefly, I know there's a bunch of nuances about it, but kind of what does it mean to classify a athlete?
Yeah, so US Paralympics sports, within every sport, there's different eligibility criteria. And so swimming is one of the more inclusive ones, whereas like if you look at 5A side football or football 5A side, I think those are only for people with visual impairment. Football 7A side is only for people with cerebral palsy who are ambulatory. And so there's lots of different sports out there, but you have to look up the eligibility criteria. For swimming, it's you have to have a physical impairment, and there's like different categories of your physical impairment, and it has to be an eligible diagnosis. Or you can have a visual impairment or a cognitive impairment. And so I do classification specifically for the physical impairments because I'm not as qualified for the eye. And then the cognitive stuff, they probably need more in-depth like neuropsych evals. And so for physical impairment, you can have hypertonia, which includes spasticity, dystonia, you can have athetosis, you can have impaired range of motion, so just contractures for, you know, conditions which could be secondary to spasticity conditions, or it could be, you know, from arthrogryposis or various other disorders out there. There are other ones. Short stature is another one. Limb deficiency, limb difference, if you have to have a significant amount. And so there's these different categories. The key is you need to have an eligible diagnosis. And so unfortunately, if your diagnosis is still in a work in progress, you are not eligible to be classified, because we need to have confirmation of what your specific diagnosis is. And you can imagine that's like more of a fairness issue and not necessarily because they're trying to exclude people. The other thing is you need to show on your classification exam enough impairment. And so I've had people who've only got like very mild spasticity in their gastrocs, and they might not be eligible because they don't lose enough points in their classification criteria. And so I always tell people who are, you know, just learning about the classification process and maybe possible referrers to the process, please, please, please don't guarantee that they will, one, be able to be classified, and two, be able to be classified into a class. Because the thought is that if your impairment is very mild, that you don't lose enough points. And so I think in swimming, the full points is 300 points, and I think you have to have 285 or less points to qualify. Then it's thought that you should be able to compete well enough with people without impairment. And so in swimming, we have a bunch of different classes from S1. So there's different classes for every stroke. for the most part. And then there's also like an S1, S2, S3. And so S1 is like the lowest level, like people who are super dependent, like they're going to be, I've seen some that have like you can barely see any movement in the pool, but they're able to swim and get across the pool. And it's really impressive. And then you've got ones who are like the S13s that are just, you can't even see their impairment because they're cognitively impaired. You've got your like I think in the physical aspects, S10s are pretty functional, like really, really high level and pretty fast. And so a lot of it is based on you're scoring them both on the bench and then also in the water. And as a medical classifier, I have a partner who's also a technical classifier. And so the technical classifier is usually like an athletic trainer or a coach, although they just changed the rules where I think they have to demonstrate a master's degree in exercise physiology or something. And so it's getting a little more stringent with who can volunteer for those positions. But it's a lot of fun. You get to know a lot of the athletes. You screen them medically and do their exam, and then you watch them in the pool. And obviously you want to make sure they're water safe for swimming.
So I think, the three of us were lucky in the sense that, Dallas has a lot of adaptive sports programs. So there's like RISE, the Athlete Foundation, and, many others. So, but what about, those who are in residency, may not want to be at that high level yet, the Paralympics, but they want to get some exposure to these athletes in the field. What advice would you have for them? How do they seek out some of those opportunities?
Yeah. So I will say, I never expected to be here this fast. I mean, of course, I remember telling someone in residency I would love to be the team physician for US Paralympic Swimming one day. And, mainly because I was a swimmer and that's where I connected with that sport. I never thought I would get here that fast. I thought that was going to take years. And I think I just got lucky with how things fell. But I will say you have to have a starting point. And the best advice I got when I was in residency, when I met a physical therapist who was involved with some of these things, was just go out there and volunteer. Find organizations and go out. And it doesn't matter if you're volunteering. You might not be able to work out the politics with your residency or hospital program to be able to volunteer as like a physician on the sideline. Because I think sometimes your residency programs don't like to deal with the liability aspects of it. Usually as a volunteer, you can get away with that because, you're not getting paid for your services or anything like that. But even, when I was a resident, I would not necessarily, or even as a medical student or undergrad, get involved with like camps, get to know those communities. Because I think once you're out there and they see you out there and then they know you're a physician, they see you as an insider and they embrace that. And, there have been multiple studies that have come out recently that have shown, that we know the population of athletes with disabilities are significantly underserved in terms of their medical needs for sports medicine. But I don't know if they know that. And I think there's this fear because I think back in the day, a lot of physicians outside of PM&R focused on what you can't do. And so there's this stigma if I go to a doctor, they're going to just focus on what I can't do. And they're going to yell at me for doing, some of the flips that we saw at the wheelchair motocross championship, right? And so like, they have this fear and they have this distrust of doctors, right? And of the medical field because they're like, they have never been supportive of my pursuits. And they don't understand that we need to be partnered and we need to show them better support and being out there when they do need our help and being respectful, but also making sure that we are, I think a big partnership that I see when I'm developing my adaptive sports medicine career and program is also partnering with organizations to make sure that we are making, sports safe. Because that's a big focus, I think, in the world of athletes without disabilities, especially in youth sports where we're constantly, we're looking at football, we're looking at, baseball, pitch count, all of that. And it's like, well, what about the world of athletes with disabilities? Like, we haven't created that criteria yet, and they might be at higher risk. And so, I think it's this balance of, yes, they are resilient. We don't want to stop them from proving what they can do, but we also want to make sure we're supporting them when they need us. And so, yes, I think getting out there, getting involved in any capacity you can. I mean, I was a camp counselor for some of the camps at Scottish Rite, which has a lot of youth camps for, kids with limb difference, kids with, rheumatologic conditions. I did our burn camp for 3 years, affiliated with Parkland, and that was a lot of fun. And so you get to know those communities and get to know those people. And then as you get more involved, you learn about all the different organizations out there and you start, say yes to things and try to get out there as much as you can.
I think
Great
that
advice.
Amazing. It is. We're having Charlie on tomorrow, and he is very involved in as a medical student. So that's what I'm in charge of medical students get involved. It is an excellent thing to talk about when you go on your residency interviews, because you've had that exposure early on, and a lot of times where they haven't. So that's something else you're bringing into the residency. So we'll switch bases just a little bit. You've been very involved with AAPM&R in the past. You're the past president of the Physiatry and Training Council from 2015, 2016. Tell us a little bit about that.
Yeah, so I think that's another thing that I say, always go for it and try to say yes to opportunities that open up. And so keep an eye out for opportunities. I knew about that. So having gone to UMDNJ with so many PM&R, people who go into PM&R every year, Sam Chu, I don't know if people have heard his name, but Sam Chu he was a big name at our medical school because he was on student council, very involved. And so naturally he got, when he went into PM&R and he went to residency at RIC, he also got involved. I think he was like the past VP for the RPC board, which is now the Physiatrist and Training Board. And so I knew him, and I had heard about, that's I think when I first heard about the RPC board through AAPM&R back then. And then Andy Collins, who was a year above me and did a combined pediatric rehab program at Cincinnati, he followed Sam's footsteps and got involved. And then I had done an away rotation at Columbia Cornell, and my senior resident was Danielle Sarno. And so Danielle was a past president 2 classes above me for the AAPM&R. And so Andy had let me know about the applications opening for AAPM&R. And I was like, yes, I've been keeping an eye out for this. I've totally, I had heard about it as a medical student. I knew I wanted to get more involved with AAPM&R. And so I think luckily, because I had been very involved with medical school, with medical education committees, and being president of our PM&R interest group my senior year, I think that made my application stronger for applying for a position on the RPC board, and I got onto the medical education committee. But it definitely helped that I also knew people who could put in a good word for me. And so I'll say it's not enough. I've had people who, I barely know, and they're like, oh man, I'm really interested. And it's like, I can't really vouch for people if I haven't worked with them closely. So find someone who has been involved and try to work with them closely and show them how much of a hard worker you are. Because, I think whenever we go through applications for that, because after serving as president, the president always, in their past president role, the immediate year after, they also serve as a nominating committee chair. And so they're in charge of looking at the applications with 2 others on the RPC board or FIT board. And we always solicit feedback from our other board members on there. And so if someone or a couple people can vouch for you and be like, yeah, I know that person, they're really hardworking, they're really passionate, they're going to make changes in the field. They're the ones who are going to help you out with getting involved. I will say, if you are not able to, I think it's getting more competitive to find these positions as more people hear about it. And there's also been more of a focus, obviously, with focusing on diversity, right? And so I know every year we get lots of applicants from Texas, from the Northeast, and we're like, well, we need someone from Kansas, or we need someone from, we haven't heard anyone from Utah in a while, right? So then when we see an applicant that's from Utah, from one of those places, we're like, oh my gosh, as long as their application looks solid enough, the AAPM&R tends to prioritize diversity. As long as they feel like, hey, they're going to be, even if there's an application that's super stellar and they've done so many things, and there's someone who maybe not as involved in the past, the AAPM&R staff is going to ask us, well, do you feel like they could do as good of a job? Yes, maybe this person's super stellar, but we need to make sure we're having diversity. Because I think there was one year where we had maybe 1/3 of the board from Texas. And it doesn't, Texas is a big state. There's a lot of programs there.
So many programs, right?
Right. So it's kind of hard, right? And it's the same thing with the Northeast. But at the same time, AAP, the point of having that board and that council is to make sure we're representing different regions in the US and representing all the different viewpoints. And so we do look carefully at female versus male distribution. the aspects of DO versus MD, where their geographic location is, and, interesting backgrounds. Like some people have had an MBA or JD. And so that brings interesting perspectives too, right? Because when we're having these national discussions, their backgrounds can be really useful. And then they also, I don't know if they've started looking at diversity with, race or ethnicity, but I feel like our board has been always pretty representative of that. And I know we've talked even at my committee meetings about, we need to take a stance about certain things. And so, having that diversity, and now the APM&R has the diversity and inclusion committee too. So I know it's a big focus out there. But I want to make sure everyone, if you are interested, always try to apply. If you can't get into that one, try again the following year. If you can't get in as a PGY2, there is now the ambassador program, which did not exist when I was a PGY2. And so every residency program has to have a PGY2 ambassador. And so if you're not able to get onto the board, you can volunteer to be an ambassador, which might be a little bit easier to get onto because it's usually by vote or whatever process your individual residency program has to select that person. Usually, I know that if we've had an ambassador who's super involved and shown a lot of interest, and then they apply for the RPC board the following year, usually the board can make like a justification in terms of, yeah, this person's been super helpful, and always offering to help out, say yes to things even if they may not be the best person to say yes. Maybe they feel like they're not the most comfortable to do it. I think saying yes to those initial opportunities is really important so that you get your name out there, show them what you can do. In addition to AAPM&R, there's also, other than the fit board, there's like other opportunities too. You can always volunteer to write articles for the residency newsletter. You can volunteer to serve on member communities. There's a lot of different member communities out there, and there's a lot of different initiatives out there right now. And just, don't forget about all the other organizations outside of AAPM&R too. If you're interested in sports medicine, AMSSM or the ACSM, you can get AMSSM is great. And also AAP for AA Physiatry, not AA Pediatrics, but AA Physiatry and AMSSM have routes for medical students to get involved.
Mm-hmm.
And so I know for AMSSM, I was their education committee fellow liaison this past year, and our fellowship representative, Benecia, at Hospital for Special Surgery, I think he was the president of the resident sports council at AMSSM. And so it definitely helps to start early, but know that if you have not started early, it's not too late to show your involvement.
Great info. All right, so we'll switch gears one more time. So, we mentioned, Benecia mentioned, you're finishing up your PGY 7 year, and we are super excited that you're coming back to Dallas here. And it sounds like you've got a lot of plans as to, what you want to do and kind of what you want to start up in the adaptive sports world community here. So tell us a little bit about what your plans are.
Yeah, so a few months ago, I signed with UT Southwestern. Yay, going back. Kathy Bell was super excited, who's the chair at UT Southwestern. And so Kathy Bell, the leadership at UT Southwestern has always been family to me. I mean, they've kept in touch with me, even though I've gone and lived at 2 different states now, but they've constantly been in touch with me and have been, such resourceful mentors to me, constantly helping raise me up, giving me opportunities that I may not have known existed out there. And so I knew it was a great fit to go back there because they've been so supportive of my career thus far. So I'm going to be going back, serving as assistant professor in the PM&R department at UT Southwestern, doing pediatric rehab at Children's Health, and then also pediatric sports medicine at Texas Scottish Rite, and then also developing a youth adaptive sports medicine program that would be a joint effort between UT Southwestern and Scottish Rite. I knew that I wanted to go back to Scottish Rite because Scottish Rite has a huge population of children with disabilities. It's the big name children's orthopedic hospital in the area, kind of like Shriners out there in the other hospital systems. And so I knew in order to make a successful adaptive sports medicine program that UT Southwestern and Scottish Rite had to work out whatever politics they had to make this gig for me. And so Kathy Bell and Bob Rinaldi went to bat for me, met with a lot of leaders at Scottish Rite and helped out with that. When I left residency, we did develop the UT Southwestern Dallas-Fort Worth Adaptive Sports Coalition. And so the goal of that was to have this huge hub or network of different organizations, because I think back when I was initially in residency, there were a lot of different organizations at DFW, but not they didn't necessarily talk with each other. And so, yes, some of the participants like went to multiple things, and so they knew what was going on, but those organizations sometimes had conflicting schedules and at the end of the day, most of them have similar missions. And so our goal at UT Southwestern, the year I left, was to build this coalition where we could create an easy way to plug in our patients that we see in our clinics and, maybe in inpatient rehab or in the hospital, and let them know about all the different resources out there. And then at the same time, our future goal, which is what I'll be doing when I go back, is serving and supporting these organizations for their sports medicine needs. And so if there is an injury, if they need a physician on the sideline, to volunteer and serve them on the sideline, I and any other volunteers, you guys can help out too. I'd love to have you guys. We're going to need a huge volunteer network, but serve these individuals where the need is needed.
That's awesome, because you guys are having your UT Southwestern's having their Adaptive Sports Expo soon. So if you're a physiatrist or any doctor that's watching and you guys want to sponsor, let me know and I'll send you the information, because our group is sponsoring something. So
yeah, it is currently scheduled for September 26th, and I am involved with the planning for that, and we just announced that it's actually going to go virtual. And so keep an eye out for more information. It's going to be a little bit different this year. But usually in the past, I think this year's the 5th year that we're doing it. But in the past, we've had an expo in person at UT Arlington, and you get to showcase, you have all these different organizations showcasing wheelchair tennis or wheelchair basketball. I think they brought in like a women's limb or amputee team for women's basketball from Africa one year. Yeah, it was like pretty amazing. And there's a lot of athletes who get to, or not athletes, patients or individuals with disabilities who just, you've never done these things before and you get to try it out, and it's an awesome experience.
It's so exciting. I'm so excited for what is to come in the Dallas area, what you're bringing. So
this is going to be amazing. All right, we have some questions, looks like. So Kelly happens to be my wife. Dr. Howe, I'm a physical therapist and have volunteered in the past with adaptive sports programs, and this talk has renewed my interest. I initially had in adaptive sports. With that said, how are the programs adapting to COVID? Are there currently any volunteer opportunities? She's thinking I would love to get more involved in the future in some capacity.
Yeah, I think right now, and I'm hoping to do more of this when I get to Dallas physically. But I know here in Kansas City, even with all sports, like not just adaptive sports, but I think unfortunately adaptive sports tends to get forgotten because they're not as well connected with the sports medicine clinician side. With all these sports, we've been making guidelines in terms of how to return to sports safely. And so I know adaptive sports, like I was just on the United Move, or it used to be Disability USA, but they just rebranded. But the Move USA, I think is their new name. They had a virtual conference, I think last month, and they've been talking about, hey, we're going to be a little bit slower with rolling things out too. But at the same time, I've also gotten emails from our Midwest Adaptive Sports organization here in Kansas City about them doing certain events, and I'm like, I don't know if that's like a great idea. Like we're seeing this surge of COVID, in Texas and Kansas City in the Northeast, and definitely people are associating it with sports. And I see my sports med patients in clinic, and they're like, they're all youth athletes, and so they're like, oh yeah, I'm going to a baseball tournament in Oklahoma like next weekend, and I'm like, oh, like okay, like at the end of the day, it's like their decision, but we need to make sure we educate them on their decision and know that, hey, just because you feel like people are like, you're hearing that more places are opening up doesn't necessarily mean it's safe to go back. But if you are going to be safe, or if you are determined to go, please follow these social distancing criteria. Like, here are the guidelines in terms of how to be safe from COVID. But then also the other component of a lot of people have been sedentary or not as active in the past few months during COVID. And so I think they're going to need us in terms of how to gradually return to sport in a safe manner so that we can focus on injury prevention. In terms of volunteering for adaptive sports stuff right now, like I think that's the main part, is like, I think creating that support for them, making some of these guidelines. My bet is like we probably won't see a lot of the adaptive sports organizations open up in-person stuff until we either get a vaccine or have a lot lower numbers in COVID, because I mean, some of these populations, maybe not, the individuals with limb deficiency, from traumatic amputation, but the ones with cerebral palsy that have decreased cardiorespiratory fitness as it is already, spina bifida, they're going to be at increased risk for illness. And so, we need to be cautious about that.
I can't wait for outside to open up, but I think it's going to be, next year before we're like safe, summer 2021.
I know. I'm hopeful that we just need a vaccine. I think that, and it has to be an effective vaccine, not like, the flu vaccine that's like hit or miss every year.
Right. How has COVID affected the end of your fellowship? Because obviously, covering a bunch of sports is huge in fellowship. So how has it affected it?
Yeah. Unfortunately, a lot of our, all of our sports coverage was canceled from March through the end of the year. I feel fortunate. I'm worried about, the incoming fellows because I don't know when they're going to be able to do sports coverage. I know so we cover Sporting KC Academy, which is our development academy for pro youth soccer here in Kansas City. And we cover them in the fall and the spring. And so I'm lucky I had that experience in the fall. And then usually I'd be covering right now in the spring, but obviously that got canceled. We usually cover the NAIA men's basketball event out here, and that was canceled in March, I believe. And then there was like a marathon that we usually do and some other things that we do, and those are all canceled. I feel fortunate. I traveled with US Paralympic Swimming as their team physician, as like my first official gig as their team physician to Australia right in February, like right before all this happened. And so I luckily still had that great experience and had a lot of great experiences in the fall. And then luckily I had some good experiences with covering during my pediatric rehab fellowship with the pediatric sports group in Colorado. So I feel okay. I mean, of course, I wish I had, a little bit more experience through the spring, as I think all sports medicine fellows did, but I still feel prepared to go out into practice. Hopefully we're able to figure out, opportunities for our incoming sports fellows. But who knows? There's a national group at AMSSM Benecia. I don't know if you've heard of this, but they are talking about extending sports medicine fellowships 2 years now. So
not know that, but that would probably not be a bad idea. There's so much to cover in such a short amount of time. I think coming out of PM&R, having that 4 years, I think you feel a little bit more comfortable than maybe family medicine, managing a lot of the musculoskeletal things. So I don't think it's a bad idea.
Yeah, they've talked about, I think they're realizing that there's just a lot more to learn in the sports medicine world now in terms of like, not just like the traditional injuries you see, but sports cardiology, nutrition, relative energy deficiency syndrome, all of the different things that maybe you don't see as often, but we should be the experts in it. And so similar to pediatric rehab, they're looking at extending ACGME accredited sports medicine fellowships to 2 years. So I don't know if anyone out there is interested in doing both fellowships. I would advocate that you do it earlier rather than wait.
Right. We had Rachel Welbell on here not that long ago, and Sheena and I were like, when things do open back up, you'll have to come too. We'll have to go to Hawaii and cover the Ironman.
Yes. Oh man, that's so awesome.
It is such an awesome experience.
It is an amazing experience, and you're so inspired. You're like, these people are amazing.
Oh, yeah. I know. And then you're like, oh yeah, I want to do this. And like every time I cover these things, I'm like, I'm gonna go home and run, and then I'm like, oh yeah.
I forgot. Yeah, I don't like to run. That's exactly right. You're like, yeah.
Not as easy as it looks.
No,
we have another good question here.
Yeah.
I know the answer to this, but Beth Yasuda asked, will there be any other opportunities for medical students to get involved in your future work in DFW?
Yeah, absolutely. And so once I start doing sports coverage, we will be definitely opening it up to volunteers to help out with those things. I know when I was a medical student, I got to work with some of the sports providers in New Jersey doing football coverage and other things. And so certainly I'll be looking for help with adaptive sports opportunities too. We'll probably either have you paired up with an attending or a resident or fellow who's interested in covering as well. So
it is a very rewarding experience to cover adaptive sports. It really is. It's intense. So
it's so intense. I mean, people like who are outside of the adaptive sports world, like just don't know.
Yeah.
Like I get so many people who come up and they're like, I know when I interviewed for sports medicine fellowships, like they would see in my CV like Paralympics, and I think I talked about it in my personal statement. you know, like adaptive sports is my passion. And so it always comes up on my interviews and they're like, oh yeah, like I've gone to a Special Olympics event before. And I was like, okay, it's different. Like, yeah, Special Olympics is great.
Right.
But it's completely different from the Paralympics world.
These are like Olympic athletes, like,
Yeah.
It's really, really cool.
They are hardcore. All right. Benecia, you want to do the honors?
Yes. Okay. So we asked 90% of our guests, if we don't forget, if you were not a PM&R physician, what would you be? And you can do both, like in medicine if you want to, and out of medicine if you want to.
There you go. You read my mind. I get this interview because I used to get this question a lot in interviews, and I was like, "Do you mean in medicine or out?" And they're like, let's just do in medicine." I was like, "Okay." So in medicine, if I did not know about PM&R, I probably would have gone orthopedic surgery, as you know, for the reasons I said earlier. Because I probably would have a similar career in terms of I probably would have just done pediatric ortho and pediatric sports medicine and ortho instead. I think for outside of medicine, I've always envied those jobs like Anthony Bourdain, who gets to travel and like try different food. I would not want to do one of those like shows where you have to try all the disgusting foods. I forget what his name is on the Food Network, but I would like, any job that like requires me to travel. I mean, I think my Fulbright year gave me a taste of that. Like I caught the travel bug, and got to like travel all over in Asia during that year, and that was awesome. Probably not the best during COVID times right now, but that in the non-pandemic world, I think that would be the dream job, is being able to travel and get paid for it.
Oh my God, that'd be amazing. And Sheena would be your travel agent, because that's what she
I'll make your itineraries.
Well, awesome. Hey, thank you so much for taking the time out to be with us.
This was great, Stephanie. This was an excellent talk. I think a lot of people enjoyed it.
Thank you so much for having me.
Yeah, of course. We're excited for you to come back to Dallas. So if anyone, has any specific questions, directly for you, what's the best way for them to contact you?
Yeah, so I'm on Twitter, and my Twitter handle is Steph Tow MD, so STEPH TOWMD, or via email at stephanietowmd@gmail.com.
All right, great. All right, guys. Well, thanks for joining us. Like always, you can follow us on Facebook, Instagram, our YouTube. So Stephanie, once we're done here, we'll upload this video on those platforms, and then also as a podcast, Spotify and iTunes.
Awesome. Thanks for all your guys' hard work.
Of course. Tomorrow, I mentioned it earlier, we'll have Dr. Charlie Kenyon on. He is a PGY4 at UW and the chief resident there. And he's also the president of the Physiatry in Training. Can get that word out, huh? Council for AAPM&R. So, and then we're going to announce a very special giveaway tomorrow. So please join us live at 4:00 Central Standard Time. And we'll see you guys tomorrow. Thanks for joining.
Have a good weekend.